Thyroiditis is basically an inflammation of the thyroid gland. So it starts off with high hormones. When the attack of inflammation happens, it releases the preformed thyroid hormone so that the levels are high. That is the hyperthyroid phase initially. As the inflammation settles, the thyroid hormone will gradually drop back down to normal. So that is the second phase. Sometimes the patients will undergo a third phase in which they go into a hypothyroid phase, and that can also last for a couple of months, several months, and then in some cases these hypothyroid patients will then revert back to normal. The relationship between thyroid conditions and the heart really depends on the level of the thyroid hormones. If the hormones are very high, they can cause an increased heart rate and patients may experience palpitations. If it's very severe, they can actually go into heart failure. Now, on the other hand, if the hormones are too low, the patient's heart rate may actually drop down to the other extreme, to below normal, in which case they may also feel very tired, and they can also end up with what you call a pericardial effusion, which means there's an accumulation of abnormal fluid around the heart. In response to the question whether there are any exercises that should be avoided, I guess it really depends on which phase the patient is at. If the patient is in the active hyperthyroid phase, we all know that in those cases, the heart is under a certain form of stress because as the thyroid hormones are high, they may encounter things like palpitations as the heart beats faster. So with that additional stress or load on the heart, we do sometimes advise your patients to either stop exercise, stop strenuous exercise, or to go slow and to just wait until the hormones come back down to normal before they restart the exercise. Obviously, if the thyroid hormones are already normal, then there's no need to avoid any exercise of any sort. If the hormones are low, on the other hand, they may feel a bit tired, right? Sometimes they do gain a little bit of weight, and sometimes that may impact their exercise capacity as well, right? But of all the three phases, the one that we would typically try to ask them to avoid exercise is the first one, the hyperthyroid phase.